We've seen those long lines of people hoping to be tested before Christmas, but there's no doubt some of those folks won't get results before Saturday.
Add to that, many are going to be gathering with people, of course, who may be unvaccinated or perhaps they don't know whether or not they have COVID. Well, joining us right now is Dr. Denise Rogers of Rutgers Biomedical and Health Services. Dr. Rogers, thank you for joining us this afternoon.
Thank you.
Well, we know the numbers certainly are bad right now. How concerned are you for what's to come after Christmas?
Unfortunately, I'm very concerned about what's to come. Omicron, it turns out, is an incredibly highly contagious variant. And we know, as you mentioned, that a lot of people are going to be gathering over the holidays. Unfortunately, the shortage of tests means that many people will gather and won't know their COVID status, and some of them will be positive. We also know that Omicron causes an increase in breakthrough infections, even those who are vaccinated. So I'm extremely concerned about what's coming.
And doctor, I know a handful of people who have still ended up getting COVID despite being vaccinated, some even boosted. So for folks out there who say, what's the point? What is your advice for them?
I'm so glad you asked me that question, because what we know is that if you are vaccinated and you get COVID, you are less likely to be hospitalized and die. If you are boosted and get COVID, you are truly, truly protected from hospitalization and death in the vast majority of cases. And so we wish it was a perfect vaccine. We wish that we could say to people, I got the vaccine, you don't need to do anything to protect yourself. That's just not the case. Very few things in life are perfect. But vaccination is critically important in helping to protect people from the worst outcomes of COVID, and that is, of course, ending up in an ICU or dying.
And we have just seen too much of that, that's for sure. Well, let me ask you this. What do local, state, and federal lawmakers have to do to try to get this under control right now?
Well, I think one of the things that lawmakers are already doing is encouraging testing. I think that we're going to see more places enforcing mask mandates because it's critically important that everyone wear a mask whenever they're indoors, except, of course, if you're in your own home. But quite frankly, if you're in your home and you invite someone over who's immunocompromised, you should probably wear a mask around them as well.
We reported earlier that today the FDA authorized the Pfizer treatment pill to reduce the risk of hospitalization and death. What impact do you think that will have?
I think it's going to have a wonderful impact, because if caught early in the stage of the disease, people take the drug, it will prevent them from progressing. It's not going to be a panacea, however, because it's going to take a long time for them to ramp up to have sufficient supply. So I suspect that they're going to try to reserve this medication for those who are at very highest risk of having a bad outcome. And the availability of this medication should not stop people from getting vaccinated.
All right, Dr. Denise Rogers, we thank you so much to talk about with all of this. I hope we can have you back soon.
Thank you.
All right, have a good holiday.